epidemic in our country and all over the world. It ruins lives, it contributes massively to our national debt, it cripples our healthcare system, and it sets citizens against each other. It is called obesity. Now, I know what many of you are thinking, and this is the general attitude of society. If these people, these fat, lazy slobs, took better care of themselves, exercised more, and ate less, all of their problems would be solved. End of discussion, right? Wrong. Obesity is a disease, not a character flaw. People of size do not lack intelligence. People of size do not lack ambition, ability, achievement. But people of size face an unending bias and are often ostracized by society. Weight bias is the last acceptable form of discrimination in today's society. What makes this discrimination so unfair is that it comes about because many people suffer from a complex disease affecting their health. Obesity is the second leading cause of preventable death in the nation, and over 300,000 people a year die from this untreated disease. Diabetes, heart disease, cancer, and countless other diseases are all related to obesity. And obese people have over 60% higher death rates from these diseases compared to normal weight men and women. I think we can all see that obesity is clearly a problem, but it has become a crisis because of the lack of access to medical treatment. As a result of limited resources being devoted to medical treatment and the lack of private insurance coverage for people suffering from obesity, there is an increase in the rates of cancer and heart disease and diabetes and depression and strokes and countless other diseases related to obesity. What this means is that many people who suffer from obesity have a very high chance of having one or more of these diseases because they are obese and lacking proper medical treatment. People afflicted by obesity are prevented from obtaining treatment because under the law, insurance companies do not provide an as complete coverage for this disease as they would for any other disease. But what we must understand today is that obesity is multifactorial, with research showing three leading causes: behavior, environment, and genetics. What insurance companies like to do is focus on behavior and blame patients afflicted by obesity by saying their lack of exercise and bad eating habits is the reason for their situation and therefore shouldn't be insured. But their argument is inconsistent with what they do for countless other diseases. So just imagine an insurer saying, sorry, your dad has lung cancer, but we're not going to cover him because his behavior of smoking was the reason for his lung cancer. We all know that this doesn't happen, even though his behavior directly contributed to the reason why he has lung cancer. You rode your motorcycle down to Tacoma and you were too cool to wear a helmet. You got in an accident and you now have a brain injury. But insurance companies decide not to cover you because your behavior to not wear a helmet was too stupid. No, they don't say that. For me, this isn't about a speech grade or a class, but this is personal. I have been a witness to my father who has been directly affected by obesity his entire life because of genetics. At one point in his life, he was over 400 pounds and couldn't even wrap his arms all the way around me, his 9-month-old daughter, because he suffered from a disease that he had little control over. So should insurance companies be allowed to not cover medical treatment or surgical procedures because of a false belief that it is the patient's fault? No. We can take huge steps to curing this problem through the essential health benefit package that is a part of healthcare reform. Each state has a health benefit package. Each state has a health benefit package that requires insurance companies to cover treatment for numerous diseases, and we want to make sure that obesity treatment falls under the package and includes private insurance coverage for obesity treatment. We can start making a difference here or in your home state by contacting your state and federal representatives and pushing them to cover obesity treatment under the Essential Health Benefit Package. King County's representative is Derek Stanford, and he can be contacted by going to the Washington State Legislature along with all other representatives of counties in Washington. Another way you can make a difference is to become a member of the Obesity Action Coalition, the nation's leading nonprofit organization helping people afflicted by obesity. So go to obesityaction.org, become a member, and sign up for the Obesity Action Coalition sponsored Walk from Obesity that happens every year across the nation, including areas of Washington. With our contribution here in Washington, we can help make a difference to the 93 million people of our country suffering from obesity. We see wrong, and we need to right it. We see suffering, and we need to heal it. We see a chance, and we need to take it. This change is the right thing to do, and it makes sense economically. By doing this, we are going to assist in the treatment of countless other diseases. After years of fighting insurance companies and healthcare providers, my dad received the treatment he needed, lost 180 pounds, and is now the happiest and healthiest I have ever seen. This change to a fully covered health benefit package is not treating people afflicted by obesity special. It is treating them with the same dignity as everyone else with the disease.